Hello again. Another case. This is a knee, a patient who is in his 40s, had some long walk on the beach, felt some pain. Since then the pain is constant, slightly aggravating, and he decided to do an MRI. What do we see in MRI? We see a huge amount of bone marrow edema in the mid-femoral con. You see this edema in sagittal, and we also see very well depicted some trabecular impaction in this subchondral subcortical area here and here and here. And you can very well see also on sagittal, less well seen on T1, but still you can see this. And in coronal PD without fat, again very well seen. What else? There is inflammation, there is some vessel engorgement on the medial side of the metaphyseal area. There is also inflammation around MCL. This is so-called subchondral insufficiency fracture, or SIF, formerly known as SONC, spontaneous osteonecrosis of the knee. I recently had this talk on differential diagnosis between subchondral insufficiency fracture, spontaneous osteonecrosis of the knee, and vascular necrosis. There is also this lecture on my YouTube channel. What I would like to emphasize is this aspect of there are three main findings. There is small cortical depression underneath the cartilage. There is focal thickening of the cortex, and there is a subfracture line. And all these are called subsufficient fracture. In this case, we can see there is no cortical depression yet. This entity, this pathological entity, usually heals with restitutio ad integrum. It means that if it heals properly, it leaves no marks. So the patient will be as good as new in a while after rehabilitation. But if things go wrong, what is the meaning of going wrong in this case? Yeah, it means that if the patient continues to not protect his limb and his walk, and he puts all his weight on this surface, there will be cortical depression here underneath the cartilage, and that might be irreversible. And that will lead to the so-called SONC, because at that point in time, this process will become irreversible, and there is no way you can reverse this process. This signal changes here in the around metaphyseal zone on the medial side of the femur is quite pathognomonic, and you can search this article and you will find this is so-called metaphyseal burst sign. There is a good article from the Oxford colleagues. So quite easy. Usually this SIF, efficiency fracture, is associated with posterior horn of the meniscus tear or the meniscal root. In this case, the patient had none, so I would expect to have good outcome. I will keep you posted if it comes for a follow-up. Thank you for watching me.